Today we will be discussing celiac disease, which is a genetic autoimmune disorder in which digestion of gluten leads to damage of the small intestine. The small intestine is a vital organ within the digestive system, whose function is to break down large food molecules into monomers. Monomers are chemical building blocks small enough to pass through the gastrointestinal tract lining. However, individuals suffering from celiac disease are responsible for avoiding food containing gluten, a protein plentiful in all grains except for corn and rice. This makes for a difficult-to-follow diet, which any deviation from could lead to complications in the digestive system. When broken down products of gluten interact with molecules of the immune system within the GI tract, complexes are formed which activate T cells. T cells then launch an immune response against the small intestine, damaging the intestinal villi responsible for nutrient absorption. This malabsorption will interfere with nutrients returning to the bloodstream to carry out necessary bodily functions at other tissues or organs. 1 in 100 people have celiac disease worldwide. Although it seems common, many people don't realize they have the disorder and will either be misdiagnosed or go undiagnosed in their lifetime. This is in part due to the fact that there are over 200 known types of celiac disease symptoms. Symptoms range from sores and ulcers of the mouth, tooth enamel erosion, muscle and joint pain or swelling, to intestinal diarrhea and bloating or constipation. Stomach pain and nausea are the two most commonly reported symptoms. Less common symptoms may include eczema of the skin and brittle nails. In women, symptoms can sometimes become so severe, infertility, miscarriages, and early menopause may occur. After addressing these symptoms, it is easy to understand why and how so many people go undiagnosed, as these symptoms are often associated with other disorders. For example, many people who present malabsorption are often diagnosed with Crohn's disease or pancreatic insufficiency. Because of this, it is extremely important for patients experiencing any of these symptoms to pay special attention to their diets and speak with their doctors in order to receive the correct testing and care. The first test to be performed on a patient presenting these symptoms should be a blood test. The blood test will detect high levels of antibodies caused by activated T cells targeting the small intestine as a response to the digested gluten. In medical terms, this blood test looks for immunoglobulin, an anti-tissue transglutaminase antibody. High levels of this antibody means testing positive for celiac disease. Although this is a preferred practice and usually successful, the only sure way to test for the disease is through an intestinal biopsy. The procedure involves use of an endoscope, a long, thin tube which is inserted through the mouth and stomach and into the small intestine where tissue samples are taken. Once diagnosed with celiac disease, it is extremely important for patients to follow instructions from their doctor. Instructions typically involve beginning a new diet free of gluten. Many with the disorder find this extremely difficult, as mentioned before, because gluten is present in most foods except for corn and rice. Doctors suggest eating foods such as eggs, fruits and vegetables, cheese, oils, nuts, and milk. Unfortunately, beer, bread, and pasta are among the list of foods to avoid. Not following the diet will only further damage the small intestine, causing pain and an increase in symptoms. Long-term, the disorder may cause bigger health problems if left untreated. Malnutrition, anemia, low bone density, and loss of calcium are 4 severe effects. Much more life-threatening is the possibility of neurological impairment such as seizures and even intestinal lymphoma or cancer.